Did you have a bad cold in late 2019 or early 2020? You might have had COVID-19 and not even known it. There's a possibility that the COVID-19 virus was around longer than we initially thought, and you could have contracted it and recovered without even realizing. Think back if you had a cold during late 2019 or early 2020 that lingered for 2 weeks or longer. Unlike a typical cold that only lasts a few days, it might have been COVID. Particularly if you had a fever or found it difficult to breathe, symptoms not usually associated with a common cold. Did you experience shortness of breath? It's not a typical symptom of a cold or flu, but is common with COVID-19. It might have felt like bronchitis, anxiety, or a panic attack. However, with COVID, shortness of breath tends to last longer than a typical panic attack and comes with flu-like symptoms. A persistent dry cough that took a long time to disappear could have been a symptom of COVID-19. A cough that started mildly but worsened over 5 to 7 days is different from a cough caused by a common cold and could indicate you had the virus. Did you have red, watery eyes? Throughout the pandemic, we've been told to wash our hands often and avoid touching our faces because COVID-19 can affect your eyes. If you had symptoms such as conjunctivitis, watering eyes, or blurred vision, it could have been a sign of the virus. Heart palpitations or chest pain could also indicate you had COVID-19. The virus can affect your heart, causing it to beat faster, flutter, or pound. You could have experienced tightness in your chest even after you recovered from the virus. Extreme fatigue is another common symptom of COVID-19. If you felt unusually tired, and that fatigue didn't improve with plenty of sleep, it could have been a sign of the virus. This feeling can recur days and sometimes weeks later. Loss of smell or taste is another telling sign. If foods and drinks tasted different than usual, or you weren't able to pick up on odors for a couple of weeks, you could have been infected with the virus. Nearly 80% of people who test positive for COVID-19 experience this issue, and it's usually a sign of a mild case. If you're curious to know for certain if you've had COVID-19, consider getting an antibodies test. Antibodies are proteins your body makes to help fight off an infection. If you have them, scientists aren't sure how well they'll protect you from getting the virus again. However, some studies show that people who have those antibodies are less likely to get COVID again. And if you're wondering whether you had a variant of the virus, it's important to note that these mutations don't seem to drastically affect the seriousness of the virus or the symptoms it causes. The primary difference is that the mutation is easier to spread from person to person. Remember to always look after your health and stay safe. Don't forget to subscribe to our channel and share our content with those you care for.